President Muhammadu Buhari, in his second emotion led in the nationwide broadcast on the extension of restriction of movement order on COVID-19 said, and I quote, "As your democratically elected leaders, we made this very difficult decision knowing fully well it will severely disrupt your livelihoods and bring undue hardship to you, your loved ones, and your communities." End of quote. He was, however, optimistic that such sacrifices are needed to limit the spread of COVID-19 and also to save lives in the country. He said the objectives of the restriction of movement is to contain the spread of the coronavirus and provide space, time, and resources for an aggressive and collective action. On this edition of Frontiers, we will be taking a look at COVID-19 and matters arising in relation to efforts at containing the spread of the disease in Nigeria. I am Obiageli Goke, and we have in the studio Mr. Paddy Ezeala, a public affairs analyst. Glad to have you on the program.
Thank you very much.
We will take this excerpt on the President's second broadcast on COVID-19 to set the tone for today's discourse.
President Muhammadu Buhari explains that the difficult decision was informed by the growing concern of global statistics on COVID-19 and the increasing figure in the country, which desperately requires tougher preventive measures and sacrifice from all Nigerians.
Our approach to the virus remains in two steps. First, to protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners. With this in mind, and having carefully considered the briefings and report from the Presidential Task Force and the various options offered, it has become necessary to extend the current restriction of movement in Lagos and Ogun states, as well as the FCT, for another 14 days, effective from 11:59 p.m. on Monday, 13th of April, 2020.
The president says available data of the virus from the Nigerian Center for Disease Control in Lagos, Ogun, and the FCT represents 71% of recorded cases out of the 23 affected states. The Nigerian leader commends the 36 state governors for initiating proactive measures through various restrictions order imposed to contain the spread of the deadly virus and promised to strengthen commitment in high-risk states.
Many state governments have also made provisions for isolation wards and treatment centers. We will also build similar centers near our airports and land borders. Healthcare workers across all the treatment centers have been provided with the personal protective equipment that they need to safely carry out the care they provide.
The president says adequate measures have been put in place to sustain the fight against COVID-19. On the impact of the initial 2 weeks lockdown, the president says it has led to 92% of identified cases and commended the timely intervention of donors and other development partners in assisting federal government to mitigate negative impact of the virus and promised to sustain palliative measures to cushion the effect. Other measures include 7,000 trained health workers and their swift deployment to 19 states, doubles the number of testing laboratories in the country, and raised testing capacities to 1,500 tests per day, with Lagos and Abuja now equipped to admit 1,000 patients across treatment centers. The president says the major space for the spread of COVID-19 is in communities and urged them to closely observe the infection prevention protection measures to curtail the spread of the virus, and appreciates effort of the traditional rulers, Christian Association of Nigeria, and the Supreme Council for Islamic Affairs and the media for sustained effort in succeeding the fight against COVID-19.
I am directing the Ministers of Industry, Trade and Investment, Communication and Digital Economy, Science and Technology, Transportation, Aviation, Interior, Health, Works and Housing, labor and employment, and education to jointly develop a comprehensive policy for a Nigerian economy functioning with COVID-19. The ministers will be supported by the Presidential Economic Advisory Council and the Economic Sustainability Committee in executing this mandate. I am also directing the Minister of Agriculture and Rural Development, the National Security Advisor, the Vice Chairman, National Food Security Council, and the Chairman, Presidential Fertilizer Initiative, to work with the Presidential Task Force on COVID-19 to ensure the impact of this pandemic on our 2020 farming season is minimized.
The president says he has no doubt that by working together and carefully following the rules, Nigeria will get over the global pandemic and emerge stronger in the end.
Once more, you're welcome to the program. What's your take on President Buhari's second address to Nigerians on COVID-19 pandemic?
Well, it was straight to the point. The president demonstrated that he's in control of the situation, and he demonstrated also that the foot soldiers, the people in the field, are in touch with him. So all the issues he touched on are all necessary issues, and which culminated in the extension of the lockdown. So we are in for it. It's 2 more weeks for us, and every right-thinking person should know that it's justified. It's the right thing to do because the numbers are not dropping. Numbers are increasing, and every day, if not by the hour. And we all know that the only way to ensure that it doesn't spiral out of control is to ensure that we reduce the rate of inspection or the morbidity, as the scientists would say. So that is it. The president is on the right track, and the ball is now in the court of Nigerians to obey the instructions and ensure that we get out of this as soon as possible.
Now, owing to the severity of the pandemic and to allow for identification, isolation, as well as tracing of individuals in contact with confirmed cases, President Muhammad Buhari also signed Regulations Number 2, 2020. How would you describe these developments?
It's the right thing to do. You know, we are in a democracy, and some of the actions you take in an emergency infringe on people's rights. And to be able to have the power to be able to do what you're supposed to do to save human lives, you have to be backed by a law, because you don't know who has what in mind after the whole exercise to come and say that you are infringing upon his rights, or somebody coming to claim his rights while people are dying and things like that. So when the president is fully empowered to do what he's doing, then we, the citizens, are also supposed to toe the line and obey. And when we do the right things, we come out of it altogether victorious.
In this same address, Mr. President was very specific about tasks of some ministries and departments. What is your view in this regards?
Yes, because the whole issue is a cross-sectoral issue. In other words, many people are involved. The Ministry of Health and the various parastatals under the ministry, the security agencies, and other. I even saw Ministry of Agriculture, you know, and all that. So the marching orders are right, and everybody must be on top of the game. Otherwise, a mistake from one arm will affect the entire system, and things will go terribly bad.
Now, talking about the same tax that has been assigned to ministries, departments, let's look at the mode of distribution of palliatives by humanitarian. You've been following up the news, and you've heard so much controversies about how these palliatives are being distributed. What do you think they are not getting right? Or what do you think they are really doing but needs more method to carry everybody along?
Well, nobody prepares for this kind of emergency. So it's evident that By the time we are preparing for this year, we never thought of this kind of situation. So now the issue of keeping data, the issue of documentation, is a problem. So the situation we are facing was bound to be there. But what I should say is that we have to take the lessons away. Manage as much as we can now to ensure that there is justice, widespread, and the right things are done. The meager resources that we have goes to the needy. And nobody is left out, if that is possible. Then after all this, we have to now look at the papers, look at the books and say, do we have this kind of documentation of people in this kind of situation who require this kind of assistance? With this, and we have to document it. And when those things are well documented, properly documented, listed out, it doesn't leave room for suspicion. It's when things are not straightened out, some people misinterpret it to be lack of transparency, which again gives room for suspicion and then can easily be politicized. So we will do what we have to do now, let the agencies do the best they can do now, but after this I think we have to go back to the drawing board.
All right, Mr. Ezeala, we'll pause here for a break. I'll get back to you. The program is Frontiers and it will continue shortly. It's glad to know you're still there. We've seen great nations of the world experiencing very high fatalities from this COVID-19. What areas should the Ministry of Health and health personnel seriously pay attention to?
Well, they are doing the right things already, but why there are more fatalities in developed countries than we have here, we will get to know afterwards. But the health sector, the health workers are doing the best that they can do. And I think we are satisfied with the survival rate we're having in Nigeria. People are recovering fast. The mortality rate is still at a tolerable level. And, but there are a lot of things to do to even protect the health workers themselves. We have to prioritize the health sector, from now onwards, and get people well paid with handsome allowances, and then protection, including insurance and all that. When it is done like that, including frequent training and retraining, it helps in reducing mortality, even of the health workers themselves. We have a situation whereby you can see health workers being infected. That can also have adverse effects on the other. But as of why many people are dying in New York, Italy, Spain, and all that, I think kudos to our health workers. It is not the situation here, which means they are getting certain things right.
We've talked about a controversy surrounding the palliative measures. Now, the president himself went further to announce these palliative measures being put in place by the federal government, such as loan repayment waivers, cash transfer, which we've seen the humanitarian ministry taking a lead. So what's your take on this palliative measures?
Well, palliative measures in this kind of situation, emergency situation, always look like fire brigade approach because it is an emergency. So
of course, it wasn't actually
exactly. So it will always be like that. But what I would say is that we have to continue with the tradition, straighten it out further, prepare, just like I said earlier, document properly, let there be more transparency because documentation implies transparency. And it will be easier for everybody, including those administering it and those who are the beneficiaries of this. It doesn't give much room for people to start suspecting foul play, because the resources are really meager, whether you like it or not, because you see what our population is. So when you have a huge country with 208 million people, it means that...
I was about asking you, considering the population of the country,
exactly.
How far can this actually go?
Something has to be done. That's what is happening. We are doing the best we can, hoping that it doesn't get out of hand, hoping that we come out of this as soon as possible. Can't imagine if this continues for a very long time, what would happen. Even those who think that are well off will drop into the critical level and things will go very bad.
Okay, government is putting so much effort and resources to ensure that Nigerians stay at home to curb the spread of the deadly disease. What's your advice to Nigerians regarding the heeding to the directive of the federal government?
The communication has been well articulated. Even individual media stations have been contributing. The government has been there, private sector has been there. I think the messages are going out, and it is the one thing, please, obey instructions. Stay at home. The virus doesn't move on its own. People carry it at the vectors. So the more we stay at home, the better for us. And the earlier we are eventually going to come out of this. But if we don't want to obey and continue moving about without face masks, not washing our hands, without practicing the necessary sanitation and hygienic measures, that becomes a very, very terrible thing. And what that means, it could be, the spread could be more and then spiral out of control and overwhelm. Can you imagine what's happening in developed countries? We can't imagine if that happens here. So we have to do everything possible to stop it from happening in the first place.
Yeah, but we've been following up this, the level of compliance since the cessation of movement was announced by Mr. President. And in some areas, especially the suburbs of FCT, you find out that people are really finding it difficult to comply by these rules and regulations. Do you think there are other measures the government could employ to ensure that such people who are disobeying actually get to stay at home?
Yes. Yeah, I've talked about messaging. I've talked about communication. I must also say that there must be some measure of enforcement.
Because Nigerians most times, except there are stiffer penalties, you will see defaulters. Why is it so?
But
because this concerns our health.
It's going to be enforcement with human face. Yes, you cannot stop people in a bid to push people from staying alive. You kill them, then you've not achieved anything. So, I mean, you've said it all. There are the suburbs where people don't seem to be obeying instructions.
Yes.
The security agencies should identify those places and try to push. And then, too, we should also find out why they are not obeying instructions. It could well be that staying indoors also means death for them. Okay. Coming out again also means. So the palliatives we are talking about, we also know we have to channel it so that there's a balance. You know, we are dealing with human beings. Human beings stays indoors for 3 days without eating. You say you shouldn't come out. So
it's not possible.
Yeah, so we have to find a middle ground and ensure that the palliatives go around and the message is also well circulated, as I said, so that they can understand why they are indoors. Some people are saying that coronavirus is not even here. They cannot see it. So why must we be indoors? But when it comes, you wouldn't be able to talk as you're talking. So we are doing the right things. The security agencies must go to those areas where people are not obeying. The message should be made to reach those places, and everything possible must be done to make sure people are indoors to forestall the worsening of the situation.
Exactly, and ensure everybody comply.
That is it.
Thank you very much, Mr. Ezeala. Thank you for sharing your thoughts with us. We appreciate your coming. The focus on this edition of the program has been COVID-19 and matters arising. And our guest has been Mr. Paddy Ezeala, a public affairs analyst. Ensure you maintain very high hygiene standards and social distancing. Thanks for your time.